Welcome you all in our YouTube channel Learning Radiology. Then start our today's topic. Today we will discuss on the topic intensifying screen. So intensifying screen is a device which are used to convert X-rays into visible light, and it convert a high energy electromagnetic radiation to a lower energy electromagnetic radiation. In general, film which are exposed by the X-rays is using screens has an image that is produced 95% light and 5% X-rays. So these are the images of intensifying screen. Intensifying screen is a plastic sheet coated fluorescent materials called as a phosphors, and phosphor is a material which convert photons energy into light. These are the construction of intensifying screen. First layer is film emulsion, second one is phosphor layer, and last one is a base of intensifying screen. What is luminescence? Luminescence is the emission of light from a substance bombarded by a radiation. There are two types of luminescence: phosphorescence and fluorescence. And fluorescence means luminescence is excited only during the period of irradiation, and it will terminate at completion of X-ray exposure. The phosphor in intensifying screen produce fluorescence. Means phosphors are used in a intensifying screen for production of fluorescence. And in phosphorescence is afterglow. The irradiated material continues to emit the light for a time after cessation of exposure to radiation, and will continue to produce an image which you do not want. These are the examples of fluorescence and phosphorescence. These are the example of fluorescence, and these are the phosphorescence, means afterglow. Advantages using screens. Like these are the advantages using the screens, like reduce the dose required for a particular examination, they have short exposure time, they have a higher contrast image compared to non-screening image. And disadvantage of screens are like introduce the screen sharpness. The luminescence effect is used radiographically in two ways. We use luminescent screen in radiography via two ways. First one is obtained an image on a fluorescent screen as in fluoroscopy, and another one is to increase the photographic response of a silver halide emulsion. These are the two radiographic ways to use luminescent effect. These are the screen construction, like base, substratum layer, phosphor and supercoat. Base one is base, and these are the construction of screen. Yeah, the screen construction like first one is a cassette front, another one is front padding, supporting layer, intensifying screen, phosphor layer, double coated film, the support layer, emulsion layer, phosphor layer, intensifying screen, support layer, back padding, lead foil and cassette back. These are the construction of intensifying screen. First one is base always act as a support for all layer of intensifying screen. It's made up of a polyester, paper and cardboard. Sizes are 250 microns or 0.18 mm thick for cassette, and 175 micron for a screens used for automatic film changer. Sometimes it incorporates a light reflective pigment like titanium dioxide. Its characteristics are like it's chemically inert, uniformly radioparent, moisture resistant, not discolor with age or on exposure to X-rays. Reflective or absorptive layer. Another layer is reflective or absorptive layer. So reflective layer mainly intercept light which going away from the film, which this redirect it toward the film. It increases the speed, but increases also the amount of unsharpness. Made up of thin coating of titanium dioxide or a similar compound of titanium dioxide. Another one is absorptive layer. Absorb the light which travel away from the film. This layer made up of dry incorporated on the base material and always slow down the speed of a system, but has an advantage of improving the sharpness of the images. Another layer is called substratum layer. Substratum layer which attach the phosphor layer to the base, and it should be thin as possible but should provide adequate adhesion. Next one is phosphor layer. Phosphor layer is a dispersion of phosphor crystals within a suitable binder. It's approximately 150 micron. The binder is a material which is commonly used to hold the fluorescent crystals together. A binder made up of a polyurethane and to prevent any moisture penetration, which will reduce the luminescence. In higher resolution, screen may also contain carbon granules or a colored pigment. Binder act as to absorb any laterally scattered light within the fluorescent layer. Characteristics of binders are like it is flexible, inert to phosphor crystal and light they emit. Provide even non-dispersion of the phosphor in the binder. Binder allow the phosphor layer to coated on to the base of the required thickness. These are the phosphor crystal. Phosphor crystal is a metallic crystalline solid naturally occurring or artificially made, which exhibit the property of fluorescence when exposed to X-rays and can be manufactured in useful form to produce high image quality. Like calcium tungstate and rare earth metals are like gadolinium oxysulfide. Supercoat is a top protective layer of the screen, approximately 8 micrometer thick, made up of cellulose, acetobitrate. Supercoat is a poor conductor of static electricity, and the surface of protective coating can be made with varying roughness. It serves three functions. First one, like protect delicate phosphor layer for mechanical damage, and also provide the surface which can be cleaned without damaging the phosphor layer. Another one is provide a smooth evacuation of entrapped air resulting in a good film like skin contact. These are the factors which affect the film construction. These are the factors of screen construction which affect speed and sharpness, like phosphor grain size, thickness of intensifying screen, nature of substratum layer, presence or absence of carbon granules or a pigment, crossover effect. Speed of intensifying screen are fast screen, slow screen or a medium screen. Slow screen also called as high definition screens. These are the differences between these screens. Fast screens are thick layer and relatively large crystals used. Their maximum speed which is obtained but with some sacrifices in definition. In case of slow speed, it is a thin layer and relatively small crystals are used. Detail is the best, but speed is slow, necessity a higher dose of ionizing radiation. In medium screen layer is a thick layer of medium sized crystal are used to order to provide the comparison between speed and definition. Type of intensifying screen are standard, rare and combination. These three types of intensifying screen are used in radiography. Standard screens use calcium tungstate phosphors, while rare earth screens are gadolinium and lanthanum. Lanthanum phosphors, they are commercially named for rare earth screen are Lanex. For rare earth phosphor are most efficient at converting X-ray to visible light. Thus, they reduce the radiation further to the patient. The manufacturer name and the type of screen are printed on one side of the screen, and the information appears on a radiograph. In case of intensifying screen, it is placed in a cassette in a close together within a film, and the visual light come from a fluorescent image will be added to a latent image on the film, and it act as a reinforce to the action of X-rays by subjecting the emulsion to the effect of light as well as ionizing radiation. The benefit are like dose reduction in ionizing radiation to the patient. Characteristics of intensifying screen which consists of a base of polyester or cellulose triacetate similar to the radiographic film. This base must be radioparent, base must be chemical inert, should be not curl, it must combine characteristic of toughness and flexibility. Intensifying, increasing film speed. There are the points for increasing the film speed like thicker phosphor layer, higher conversion efficiency, higher absorption phosphor, decreased resolution of image. These are the film screen combination must match so that the emission characteristic of the screen match the spectral sensitivity of the film. It is also important to note that when double loading cassette, one must use faster film or increase the kbp as only one side of the each film will be contact with intensifying screens. In case of regular inspection of intensifying screen, intensifying screen in a flat cassette may come loose and should be reattached immediately. Loose screen are an invitation to error in the dark room. It is easy when loading a cassette to slip the film on the top of both screen if they are unattached. The felt pad or a foam rubber in the back of the cassette may have become insecure or worn. Screens which are old or cracked can be seen to have fairly mottled appearance, and this will be reproduced on a radiograph. When this is noticed, it is the time to discard the screens. Care of the intensifying screen are easily damaged, so their fluorescent emission can be affected if the active surface is soiled even slightly. Screen must thus be kept clean, otherwise light photons will be prevented from them reaching the screen and creating an image, and the screen in that area will appear clean. That will also create high spot which will create wear. Ensure that the screen is dry before closing the cassette, otherwise the gelatin on the surface of the screen will stick together. Intensifying screen factors. The intensifying screen only has a meaning when assessing one particular type of a film which is to be used either or without the benefit of the screen. Another one is it changes the kV. Intensifying screen is not constant for all densities. Okay, thank you. Comment on this video, like the channel, like the video, subscribe the channel.